I'm Dr.S.Ayyappan, Senior Consultant Surgical Oncologist of Apollo Cancer Centers, Chennai. I'm going to talk to you about cervical cancer. Cervical cancer is the most common cancer of the female genital tract. It can occur in the middle or in the elderly age group. It's a cancer which usually occurs in the lower part of the uterine segment, or we call it as the mouth of the uterus. Human papillomavirus, which is a disease which is transmitted by sexually transmitted disease, is the commonest cause of cervical cancer. The important signs and symptoms of cervical cancer is irregular menstrual bleedings or intermenstrual bleeding. And very important thing is patients can have bleeding per vagina following sexual intercourse. It's a very important thing. We should not ignore the post-coital bleeding. Some patients can have foul-smelling vaginal discharge, and some of the patients, if it is an advanced disease or if the patients are having a locally spreaded disease, they can also present with pelvic pain. They can have some urinary complications. Some patients do develop some defecation problems. It is very important they go on with the gynecologist. When we talk about the cervical cancer, there are two things which we need to talk. First is the diagnosis of the disease. Next is the treatment. To diagnose the disease, a proper clinical examination of the patient is very important. The clinical examination, usually we talk about a speculum examination, wherein we'll be able to visualize the entire cervix to see whether there is any abnormality and to properly examine the cervix visually, and then to take a biopsy if there is any problem in the cervix. By doing this, we'll know the exact type of the cancer which is affecting the cervix. Next is to see the amount of spread of the disease, whether it is a localized spread or whether it is spread throughout the body. For this, we need to have the investigations. The most preferred investigation next to a proper clinical examination is an MRI of the pelvis. We also need to have a proper X-ray chest, and we need to assess the liver condition also of these patients. That is to do the exact staging of the disease. Why is staging so important? The treatment of any cervical cancer patient depends on the exact stage of the disease. Sometimes we do have cancers which are very early. We call them as in situ diseases. That is, before an invasion of the disease, we have something called the in situ disease. We call it as a stage 0. Such cases can be treated by conservative methods. What do I mean by conservative methods? We will be able to retain the cervix, we will be able to retain the uterus also. That we call as a conservative surgical procedures, wherein only the cervix can be removed or a part of the cervix can also be removed, so that we will be able to maintain the whole organ per se. So, if you have a stage which is earlier, for example, if it is a stage 1 disease, such patients are treated by either surgery or they can be treated by radiation therapy. If we have a stage 1 disease, the stage 1 disease can be treated by a surgical procedure where we call it as a radical hysterectomy. The radical hysterectomy can be done by an open procedure. In some centers, they do it by laparoscopic procedure or robotic. But there is a slight controversy as of today. So, open procedure is the treatment of choice. The next is when we go to out of the stage 2 or 3 diseases, we usually incorporate the other modalities of management like chemotherapy and radiation therapy. Radiation therapy plays a very important role in the treatment of cervical cancer when we call both the stage 2 and stage 3. When we go to stage 4, stage 4 is a very advanced stage of disease wherein the treatment can be given to the patient by chemotherapy, but we will not be able to cure these patients. We will be able to prolong the life of the patient. We will be able to treat the disease. We will be able to control the disease to some extent, but the cure is a rarity in stage 4 disease. Generally, we will not be able to cure these patients. So now, once we cure the patient, what is going to be the prognosis? Obviously, if the patient is going to be in a early stage disease, that is stage 1 disease, the prognosis is very good. What do I mean by the prognosis? The time the patient will be able to survive after the treatment will be long. Many a patient in cervical cancer, they will live long if the diagnosis is done earlier stages. So, detecting the case early is very important. What happens if the patient is in an early stage, that is in the middle stage? So, these patients also do very well, and the patients who are diagnosed in the late stage, they will be able to have a comfortable lifespan but the lifespan will be very short because, as I told you, they cannot be cured of the disease. Now, how do we prevent these cancers? It is very important that we go for a proper clinical examination. Once we cross certain age groups, we need to go for proper clinical examination and screening should be done. So how do we go for the screening? The screenings are usually done by something called a pap smear. That's a very simple test. It is not going to be painful. The patient needs to understand they don't need to be scared about the clinical examination or the pap smear. Once they cross certain age group, that's preferably after the age of 40, they need to have a proper examination by a gynecologist or the Gynaec Oncologist. They need to have a pap smear and a proper clinical examination and a per speculum examination. The cervical cancer is one very peculiar or a very special cancer where we have something called a vaccination. So these patients, that is patients before, after the age of, once they attain the age of menarche or when they are sexually ready, and usually it differs from country to country. Some countries they start at the age of 9 itself, vaccination can be started at the age of 9, they go on up to the age of 45. In some countries it's from the age of 13 up to the age of 45 or something. You can go ahead and do vaccination for these patients. The main idea of vaccination is so that we'll be able to prevent the acquiring of human papilloma virus, which is a sexually transmitted disease. The final message in cervical cancer is, it is very important for all ladies that they get their cervix properly examined and they do a vaccination also, and they should not hesitate to meet the doctor. Once you have completed the treatment of cervical cancer, it is important that you need to be on follow-up. What do I mean by follow-up? A disease has been treated at one point of time, but the disease can come back if there's going to be any microscopic disease left behind. So these patients need to be on follow-up. Initial phases of follow-up will be once in 3 months, then it becomes once in 6 months, then it becomes once a year. This is mandatory. Patients who have completed their treatment, they need to forget at some point of time that they've been suffering from cancer and they need to go on with their routine life. For some patients, they might have some complications in the long term. That is, after they completed the treatment, after 3 years, 5 years, they might have some complications which can be treated comfortably with medications. The main thing what I want to mention is patients should not be afraid of treatment of cervical cancer, and they need to understand they definitely have a life after the treatment of cancer, and that life is also going to be very comfortable and they'll be able to live comfortably after treatment. Thank you.